Morning, Bob.
Good morning.
I'd like to take off my mask this morning. Pleased to have with us this morning Abby Sauer, Dodge County Public Health Officer. And as we all recognize, as we head into September, COVID is definitely back in the news, and rightfully so, with what's happening both locally, statewide, and nationally. And appreciate Abby making the time to provide her perspective and an update of what's happening in Dodge County as we move into September. And we certainly recognize it's been a kind of a roller coaster the last month or so, and looks like the roller coaster will probably continue into September.
Yes, definitely. So our numbers, our COVID positive cases are definitely on the rise. We have been averaging, or last week we averaged about 20 new positives per day. So definitely more than what we've been seeing recently. About 6 weeks ago, I believe we were at about one a day. So definitely having that rise and those numbers going up in our positive cases. A steady rise in hospitalizations as well. We're seeing more and more of that. We have not heard that the hospitals are in a critical status yet, but definitely a lot more hospitalizations lately. At this time, the Delta variant is the variant that we're seeing here when the state does their surveillance. We don't get specifics on who has Delta and who has others, but a percentage, and Delta is definitely that prevalent one, and we're seeing more and more of that. And which, with the variants, that is one of concern because it is very contagious. It's a lot more spreadable than some of the original variants. Viruses do they do change, and so different variants come on, and that is very common with any virus. But they look at, or what the state is looking at, is those ones that are more concerning, which means that they're more spreadable. They may not be as effective, or the treatments that are out there may not be as effective, and that's what the Delta variant's showing. We continue to do our contact tracing with public health, and so that's identifying those positives and trying to identify who they may have exposed, and trying to get them to stay home so that we can try to box that virus in and not continue the spread. So we're really encouraging people to still listen to public health guidance, answer our calls, and follow through with our recommendations.
Well, currently, and you can correct me if my interpretation is incorrect on this, if an individual is vaccinated and they're identified as a close contact, does that individual who's been vaccinated, are they still required to quarantine, or has that changed compared to was like a year ago?
Right, no, that you are correct. If somebody is vaccinated and we identify them as a close contact, they do not have to quarantine. So we don't tell them, hey, stay home, like we do with others that aren't vaccinated. So with that, we still follow through with them, and encourage them to self-monitor and check for symptoms, those kind of things, because there is a chance of breakthrough infection. Breakthrough infection is when somebody has been vaccinated, but they then still get COVID-19 and test positive and may get sick. But with that, what studies are showing, and the data is showing, as they're looking at those people with breakthrough infections, it's showing that they don't get as sick, and there's less chance of hospitalization and less chance of dying from COVID.
Okay, then during the month of August, as public health officers, you and your team, you've been in contact with the schools on a regular basis, and also, as you touched on earlier, with the medical, with the hospitals and so forth in Dodge County, keeping a tab on what's going on as far as hospitalizations and so forth, correct?
Definitely. So we have a continued relationship with the hospitals, finding out how many COVID positive cases they have in the hospital, how those individuals are doing, and just kind of also how they're doing in the urgent cares and ERs, because that's something that can really cause a hospital's critical status to go up if they're being overwhelmed in ERs and urgent cares for people coming in with not having to be hospitalized, but having to at least get some treatment in the urgent cares and ERs, and then also for testing as well. So we keep a tab on that and that continued relationship and collaborations with the hospitals, and then also definitely with the schools. I have a weekly meeting with the schools all through summer, talking about best practices, recommendations public health may have, and trying to keep our schools open and safe this year.
Okay. And you and your team were recently at the Dodge County Fair.
Yes, we had a vaccination clinic every day of the fair, Wednesday through Sunday, and we vaccinated with Pfizer and with Johnson & Johnson. And we ended up not huge numbers at the fair, but about 8 people per day, which is still 8 people that may have not gotten a vaccine if we hadn't been there, and being available for them. So it was a good turnout. We answered a lot of questions, which that's another thing we want to be there for, is to if people have questions about vaccines, we want to be there for them to help them, guide them, and give them some answers.
Well, and for any other public health concern as well, beyond COVID.
Oh, definitely.
Because you and your team have greater additional responsibilities, I should say, not greater.
Definitely.
Beyond COVID as well, that with public health issues throughout
Yes.
the county as well.
Definitely.
So it's a great opportunity to have that availability with the public during the fair.
For sure.
I'm sorry, Bob, you had.
So those inoculations at the fair, was there a particular medicine they chose over another? Did they choose the one dose over the Pfizer? Or don't you know?
No, it was about probably 50-50. So
Okay.
the Pfizer is only for 12 and older, so we did do is the only one that goes for the 12 to 17 age group. Let me rephrase that. Where Johnson & Johnson is for 18 and older. So with that, we did have a lot of youth come through, and they're only eligible for the Pfizer. So they didn't really have a choice. But we did about, I'd say 50-50 for Pfizer and Johnson & Johnson at the fair.
And
So
then did you schedule the second shot then at that time?
we did not schedule the second shot, but we gave them our information to call our vaccine hotline and schedule it. So
Okay.
they had our number, and then all they got to do is call that number, and the ladies on the phone will schedule the vaccine for them.
All right.
And what's your current status with offering a vaccination clinic?
Yeah, so currently we are offering Pfizer clinics we are next week actually, or this week, we're offering one Wednesday in Horicon in the evening, and then Lamira on Thursday in the evening. And those are both Pfizer clinics. And then every Friday we have a Moderna clinic, and we're doing Johnson & Johnson clinic, and that is at our office.
That's at the Henry Dodge
At the
office.
Henry Dodge office building.
So that's every Friday.
Every Friday from 1 to 3, we have Johnson & Johnson and Moderna.
So the individual can select which vaccination they'd like to receive. correct?
Exactly. We have all 3 and all 3 available at our health department. But then, yep, on Fridays they can come in and say they want Moderna or Johnson & Johnson.
Okay, and the Moderna, that's a 3-week interval between?
4 weeks.
4 weeks.
So Pfizer is 21 days between the first and second dose, and Moderna is 28 days.
And have you been receiving any calls or questions regarding the boosters? There seemed to be some discussion nationally about a third shot.
Right. So we've been receiving a lot of calls about the booster shot. Right now, the only individuals that are eligible are those that are severely immune compromised. So individuals that are on cancer medications that knock down their immunity, and then there's some other qualifications as well. Some medical conditions that make somebody eligible. But at this time, we're not doing booster shots for those individuals because it is a very small group, and we're encouraging them to go to their medical provider to get the booster. But coming down the line, and we know it's going to be soon, is that everybody's going to be eligible for a booster vaccine if they have if they've had Moderna or Pfizer. There is no booster for the Johnson & Johnson vaccine, but that booster is 8 months after the second dose.
After the original.
After their second Pfizer or Moderna. So that will be putting us in probably about September, where those individuals that received their second doses in January will start being eligible to receive their booster vaccine. So it's going to kind of be a rollout as similar to when the vaccine came out, just because that's how it rolled out for getting that first and second dose.
Has there been any discussion regarding the booster as far as potential longevity, or is this going to be, do you anticipate, I know that it's probably not determined yet, would this be something similar to the flu shot, where annually there's always a push in the fall to get your flu shot? Do you envision that going forward? I'm not trying to put you on the spot with that, Abby, but
I don't have an answer for
Yeah,
that, and I
that's
think they don't have that answer yet, just because this is new, and to kind of see how it goes. Time is going to tell which way this is going to go, if it's going to be an annual vaccine or if it's just going to be a few doses and then you're protected. For instance, with hepatitis B vaccine, it's a 3-dose vaccine. You get 1 dose, a month later you get a second dose, and then 6 months later you get a 3rd dose, and then you're protected for life. So is it something like that, or is it an annual? I think we have to wait and see at this point.
and that's something that would be either from the CDC or FDA, something at the
That is correct.
federal level that would do the research and
Yes,
provide.
and research is being done currently, so there's a lot of scientists looking at that and trying to see where this is going to go.
Okay. All right, Bob, do you have any questions for Abby?
I'm good.
Well, you can certainly tell, Abby, with as public health officer, and you and your team certainly have no shortage of issues to deal with, and we kind of thought we had some of this behind us, and now as we head into September, there's some uncertainty again, and with the schools starting, but we certainly like to have everybody outside, right? Outside activities is good, and
Yes.
we have the mask, but at least outside, and there's no mask mandate. We want to be clear on that Dodge County or Public Health does not have the authority nor administratively to issue a mask mandate, and that would have to be up to the Dodge County Board of Supervisors. And the same with vaccination mandate. Dodge County does not, as we head into September, have a requirement for employees to be vaccinated, even though at the federal level there was direction by President Biden in late August to require nursing home staff to be vaccinated. And with Clearview, the Dodge County long-term care facility, we're still waiting for guidance at the federal level regarding that, and that regulation is supposed to come out sometime during the month of September from the Centers of Medicare and Medicaid, that's CMS, and they're the ones who would provide the regulations. So at this time, we're not sure what that looks like. Would there be some exemptions? We don't know at this point, and so we're awaiting federal or clarification on regulations at the federal level regarding what this means potentially for Clearview, and as stated at this time, we just don't know what that looks like. So there's a lot of moving pieces as we head into September, and hopefully, we'll be optimistic that we'll get through September fine, and the positives would decrease. One thing I do want to ask, has there been any discussion, maybe it's premature, but there was the COVID test site in Beaver Dam that was supported by Public Health Emergency Management and the National Guard. Has there been any further discussion regarding that, or Any update you can provide if there would be a community test site again?
Yeah, so we had shut down the community test site because we had a lot of availability in our county at the time for testing, because not only did we have the Walgreens and our other hospital clinic partners, but then Hometown Pharmacy also started COVID testing at all their sites, Mayville, Beaver Dam, Randolph. And so with that, it was decided, and our numbers were very low with turnout coming into our test site, so we had discontinued it. But now our numbers definitely are going up, and the need for testing is going up. At this time, we are looking at reestablishing the test site in Beaver Dam, but it is now dependent on the state of Wisconsin and the National Guard being renewed, because they were only slotted to go through the end of August. And so we're waiting to find out if they're going to be renewed and if we can then resubmit for them to come back to us and open up the test site. So hopefully that will happen, and we'll be able to have that opportunity for people to get tested at a free test site in our community.
And I certainly anticipate, as you've done in the past, that something like that would reopen. Public Health would issue a press release
That is
and
correct.
to make that widely known to the public and so forth.
Yes, definitely.
Okay, so we'll stay tuned on that. And again, I want to thank Abby and for all she does and your team. It's a great effort, and it was great to have you out at the fair and your team out at the fair and to interact. That's a great opportunity. So thank you very much.
Thank you.
Other news, Bob, as we head into September, it's budget time again, looking at our proposed 2022 Dodge County budget. We'll be, during the month of September, working with department heads, refining, making some adjustments to what's been submitted, updating the Finance Committee and the County Board, and the budget will be distributed to all County Board Supervisors at the October County Board meeting. So the month of September, it's everybody rolling up their sleeves on the budget and working together, following some directives from the Finance Committee regarding the budget. A couple highlights from the Capital Improvement Plan, 2022-26 5-year plan, looking at some projects for 2022, building maintenance-wise, hoping to upgrade the elevator at the Henry Dodge office building. Very important for the accessibility at Henry Dodge for the public. We have a bid opening for that upgrade, and hope to have that funded in the 22 budget, along with some maintenance repairs. The courthouse and the jail, looking at having the roof replaced. The building opened in 2000, so we're looking in 2022 to have the roof replaced. That's quite an extensive project when you look at the two buildings. Also looking at having one of the main air conditioning units in the courthouse replaced in 22 as well. So it's as some of our facilities begin to age, we, just like at your home, you have to take care of some of the basics, and that's what we're trying to accomplish in 2022. Also from a highway perspective, this year's been very successful with the County Board authorizing a $9 million borrowing early in the year for various road projects, and going into 2022, hope to have a second influx of dollars for road projects, whether it's through a borrowing. There's still some uncertainty at the federal level regarding the infrastructure bill, and will there be funds flowing to Dodge County if that legislation would be approved, and how would that look like? So those are issues we're monitoring at the federal level, and also trying to prepare hopefully for another 30 plus miles of highway improvements in 2022. Also wanted to touch on, at the end of September, Saturday the 25th, is Fall Fest at Harnisch Park from 8 to 4 8 a.m. to 4 p.m. There's a breakfast 8 to 11. Many outdoor activities for all ages. It's a great family event, and we're certainly hoping by the time we reach September 25th, it's not so humid out. I think we love summer, but some of this humidity, I think we're all getting a little tired of that a little bit, but I guess we shouldn't complain. But so we're hoping for a great day on Saturday, September 25th, and if you haven't been down to Harnischmeyer Park, please check it out. And again, it's a great family event. Outside of the breakfast, all the events are outdoors, and it's just a great opportunity to explore one of Dodge County parks.
All right, last year when we were talking about the budget, there was a lot of uncertainty because we didn't know what the economic activity was going to be like, or sales and things like that.
Mm-hmm.
How did that work out?
Well, actually, we were pleasantly surprised in 2020 and even so far in 2021. You touched on briefly, Bob, the sales tax remittance. Actually, 2020, at the beginning of 2020, when COVID first started, we anticipated a reduction in sales tax remittance somewhere between 25 and 30%. And Dodge County wasn't alone in that planning for a reduction. And as it turned out, many counties in Wisconsin, including Dodge, actually had the highest amount of sales tax remittance received. And so in 2020, the remittances were the highest on an annual basis since the inception of the sales tax. And we attributed that to a great many individuals shopping online. And so it was a pleasant surprise. In 21, we're on pace through the first 7 months at setting another benchmark, reach another plateau in the sales tax remittance. So it's remaining very strong, and we're looking to hopefully fund some of our capital improvement projects through the sales tax remittance, take pressure off the tax levy. So we've been pleasantly surprised the last year and a half of how that's held up, and we're pleased that our original expectations were incorrect. It's one time we like being incorrect. So we're looking forward to seeing how that transpires the remainder of 2021 and see how things start off in 2022.
So with the sales tax remittance, that can only go toward maintenance, can't it?
Well, there's a policy that the county board has adopted regarding the application of sales tax remittance, and we're following the county board's policy regarding allocating some to highway projects. It has to be capital projects, and also it takes care of debt service, the principal on debt service for the county. So that's following the policy. It's an internal policy developed by the Dodge County Board of Supervisors, which we're following.
Okay.
And I should note that the September Dodge County Board meeting, regular meeting of the supervisors, is Tuesday the 21st at 7 p.m., fourth floor of the administration building. And as a reminder, the county board meetings they can be viewed live. They're streamed live, and if you're not able to watch it live, the video of the entire meeting is available online, and you can watch it at your leisure afterwards. So it's a great opportunity to see firsthand, and the county board continues to meet, has a special meeting scheduled for the third Wednesday of each month for the strategic planning initiative that they're currently working on. So in September, that's the 15th, just the way the calendar falls, and then the regular meeting on Tuesday the 21st, and the special board meetings are streamed live as well. So you could watch it live or check out the video of that after the meeting. So that seems to be working out very well to have the streaming service. And that's all I have for the month of September. Hard to believe we're talking about September already. But fall is coming, which may be a good thing.
Right.
We like the change in the seasons.
All right, thank you for coming in.
You're welcome, Bob. Thank you.